Hi everybody, I'm Gregory Zubakov. Welcome to podcast. We are streaming from Hadassah University Hospital in Jerusalem, and my guest today is Professor Aron Popovtzer, the director of Hadassah Institute of Oncology. Hello, Professor Popovtzer. It's
Hello.
a pleasure to have you.
Hi, it's nice meeting you all, and I'm very happy to be here on the podcast.
Before we start talking about proton therapy at Hadassah Hospital, you might be able to share a little bit about you and how you got into oncology.
Actually, it's a good question you ask. My first residency was actually in otolaryngology and head and neck surgery, which is a 6 years program in Israel. And after 4 years in the residency, I saw myself more and more focused on cancer patients. And I thought that that was what interested me mainly. And then there was one patient that I remember that came, and we did this huge operation, which we called the total laryngectomy for him, and we had this huge fulfillment that we have cured the patient. And several months later, by coincidence, I went through the oncology center and I saw the patient. He looked so sad, and I asked him, "What's happening with you?" And he told me that he has a lot of lung metastatic disease and he doesn't think he's going to survive for a long time. And then I understood that if we really want to cure patients with cancer, the best way is through oncology and not through surgery. And this led me to perform a second and third residency in oncology and radiation oncology. And I think that in both of these perspectives, in radiation specifically, and also in medical oncology, we are going to change in the future what's happening with our cancer patients.
Thank you. So what about proton therapy?
Proton therapy is a different type of therapy. Until now, and in most places of the world, we treat cancer patients with photons. Some of them are treated with electrons. Each one of them has its advantage. Electrons has an advantage. It's very good for very shallow tumors. Photons are good for all tumors. The problem with photons is that when you treat with your standard photon therapy, the wave which delivers the radiation continues, meaning that if you have a tumor, the area beyond the tumor will also get radiation. And obviously, even with the best and most modern technology of treatment, we always have toxicity for the tissue surrounding this tumor, because if you want to treat a tumor and you treat with photons, so the tumor, let's say, will get 100% of the treatment, and that's what you want. But if you continue a centimeter or 2 or 3 centimeters beyond the tumor, there will be still treatment. And this means that the tissues surrounding it will get treated, and sometimes to 50 or to 60 or to 70% of the initial treatment, and sometimes this may be critical for the patients. For example, if we are treating an area which is very close to an optic nerve, which is responsible for what we see with our eyes, and we have to treat something a half a centimeter beyond it, obviously the optic nerve will get treatment, and therefore we can cause damage and we can cause blindness. The same thing would be if we treat something around the brainstem, which is also a very crucial area. The same thing would happen if we treat the areas which are very, very adjacent and close to the spinal cord. So the advantage of protons are, in contrast to the photons, that the way their biology and their physics act is they have a specific wave, which we call the Bragg's peak, meaning that the radiation starts going and then it reaches a peak. And this is we want to treat the tumor, a specific area of a peak, and then the peak goes abruptly down, meaning that the area surrounding this peak will almost get zero radiation. And this is very important specifically for tumors which are in areas in which we do not, and we really want to avoid treating the areas surrounding the tumor.
Thank you. What types of cancer can be treated at Hadassah Proton Therapy Center?
So at this point, we are starting our proton center, and therefore we are treating recurrent head and neck cancers, in which we are really worried about the toxicity that can be caused by the treatment. Specifically, we have areas like the salivary glands, like nerves, for example, the 5th, 7th, 9th, and 10th nerve. These nerves are responsible for our motor movements of our eyes, of our face, of our swallowing, and we really want to avoid damage and dysfunction for these areas, and therefore we are doing this. We are treating recurrent brain tumors in which we have very vital organs. We are treating spinal cord tumors. we have the same problem that we do not want to cause damage to the spinal cord. And very soon we're going to also start a big project in which we are treating pancreas cancer, since the pancreas cancer is very close to our small bowel. And one of the problems when you radiate the pancreas is it's very difficult to irradiate the pancreas without causing damage to the small bowel, and this which limits us with our capability to treat these areas. In Hadassah Proton Center, we will be able to treat all these areas with protons.
What technology is used at Hadassah and what advantages does it have?
So I must say that I think the main advantage in the Hadassah Center is in most of the centers, the protons are given to the fact that the patient lies down and there are several beams going around the patient. Now the problem of this, that in contrast to what happens in photons, in which we can create numerous numbers of beams, we can create even 360 beams. In photons, we can only give 4 or 5 beams, and therefore it's very difficult, even with the protons, to give a very accurate treatment without affecting the near area, because we're not able to model and to sculpture our area. And what we're doing in Hadassah, the treatment is given differently. The patient actually, we have one beam, and this is the one beam of protons, which is given in a cyclotron, and the patient turns around, and there's a special chair in which the patient sits, and this chair can move even small, very small degrees, and then you can treat the patient with numerous amount of angles, and this way we can be more accurate, and we can treat the patients and actually model the treatment as we wish. Now what's interesting, what we do in Hadassah is, for each patient we will check 2 different plans. We will check our optimal photon therapy treatment, which will be planned with the most modern VMAT machine, and then we will compare it to what we're able to treat in protons, and we will see what's better for the patient, and we will treat with the better treatment. Furthermore, in Hadassah, in our proton machine, we have not only a cone beam CT to see that the patient is seated well, we have actually a very accurate and good CT, and this promises that the patient will not move at all during the treatment, and this promises that the treatment will be as accurate as can be, and this is the best thing you can do, and the most modern treatment that exists today in protons in the world.
Okay, and when we talk about a patient, how long usually does it take for proton therapy?
So I think that when we talk about the patient, the usual treatment for proton therapy would be 40 up to 45 minutes. In this case, since we don't need to treat from different beams, but we have one beam and the patient can move, it will be shorter, probably something towards 25 to 30 minutes. And when the patient has to lie down, in this case sit, which is easier, every minute counts, and the shorter the treatment will be, the better it will be, and the easier it will be for the patient to be treated.
Okay, so we got requests from other countries. How would you like to recommend patients from other countries to get a consultation by telemedicine? Is it the appropriate way to do that?
So to begin with, we're very happy and we're very proud that we'll be able to help other patients from other countries, and we think it's important to help not only the Israeli patients but all the populations that we can. I think that the first consult can be through telemedicine, to see that the patient is appropriate in general for this kind of treatment. And after we finish this first stage and understand that in general the patient could be adjusted by us and could be fitted to proton therapy, then we would suggest the patient to come here to the Hadassah Medical Center in order to actually make sure and go over the small details, and to make sure that the patient is suited to this kind of treatment, and to make sure that we actually can give him an added value through this treatment. We do not want to treat patients in which there is no advantage over the standard photon treatment that I'm sure your patients can get very well in wherever you live.
Okay, thank you very much.
Thank you. It was nice meeting you, and hope to see you guys in the future, and hope to collaborate with you all, and have a good day. Bye-bye.
Thank you.